Hello friends, so keep watching this video till the end. Please subscribe my channel, Betnovate. Hello friends, today we will talk world's most selling bacterial infection cream which is used for skin problems. Betnovate N cream is a strong and rapidly effective treatment for inflamed skin conditions such as eczema, psoriasis, and dermatitis in which infection may be a problem. The main active ingredient, betamethasone, as valrate, 0.1%. An antibacterial agent, neomycin sulfate 3%. A preservative, chlorocresol. In a base containing citomacrogol 1000, white soft paraffin, and liquid paraffin. The cream does not contain any lanolin, parabens, or coloring agents. Betnovate N cream is one of a group of medicines called topical steroids. Topical means they are put on the skin. Topical steroids reduce the redness and itchiness of certain skin problems. Betnovate N cream also contains neomycin which may help to prevent or clear up some bacterial infections of the skin. If you want to ask about its work on fair complexion, I would say that Betnovate N cream is used for skin infections, not for skin brightness. Let me tell you, Betnovate is a steroid cream that contains clobetasol in it. This is a potent steroid and should never be used on the face for long term. If at all is used in other parts too, then not beyond 15 days. Once started, applying it on the face initially gives a light complexion. This is due to a mild break in the activity of the cells that produce color. So it gives the initial fair complexion. But with regular use, it produces skin atrophy and hence dependence on it. When you ask me about its side effect, I would say it helps most people with skin problems, but it may have some unwanted side effects in some people. If side effects occur, they are most likely to be minor and temporary. However, some may be serious and need medical attention. The most commonly reported side effect is local irritation, which includes itching, burning, dryness, redness. How to use it? Before you start using Betnovate, wash and dry your hands thoroughly. Gently rub a small amount of cream or ointment on the affected area as directed by your doctor. After applying the ointment or cream, wash and dry your hands thoroughly, unless it is being used for treating your hands. You can use twice a day. Thank you for watching our video. Please subscribe for more awesome healthy tips.